The ketogenic diet as a treatment for diabetes. Diabetes is said to be a progressive, chronic disease, incurable, in other words. Recently, case reports and clinical studies have accumulated claiming diabetes reversal with a low-carb or ketogenic diet. Many will debate if reversal is the right term, since adding in sugar and flour will bring their diabetes back. Nevertheless, there remains no doubt that people with diabetes benefit from these kinds of diets. 1. For diabetics, both type 1s and type 2s, a well-formulated low-carb or ketogenic diet. Before going deeper into the topic, let's first clarify what diabetes is and how a ketogenic diet is defined. What's a keto diet? A ketogenic diet is very low in carbs, high in fat and moderate in protein. For a weight-stable person, no more than 5% of calories should come from carbs, 70 to 80% from fat and 20 to 30% from protein. With this macronutrient distribution, individuals do not rely on glucose as a major source of energy but use fat for fuel instead. Fat is used to produce ketone bodies, which are used for energy or to regulate certain genes. 2 ketone bodies circulate in your blood, acetoacetate (ACAC) and beta-hydroxybutyrate (BHB). A third ketone, acetone, is spontaneously created from acetoacetate. It is not a source of energy but is useful for ketone measurement. Check our ketone measurement guide to learn more. Because the ketogenic diet replaces carbs with fat, it keeps blood sugar levels low, reduces the need for insulin and has an overall positive effect on insulin signaling. We will describe further down why this is so crucial for diabetics. What is diabetes? Diabetes is diagnosed when your fasting blood sugar is above 125 mg per deciliter or your HbA1c, poor proxy for 3-month average fasting blood sugar, is above 6.5%. However, that's not what the disease is, that's just how doctors diagnose it: uncontrolled blood sugars. The disease exists way before you see high and unstable blood sugar levels. Diabetes is actually a metabolic problem. It's characterized by the hormone insulin no longer exerting its important actions appropriately. Your cells and tissues don't hear it knocking, so to speak. So you produce more and more insulin, which eventually fatigues your pancreas. This deluge of insulin, hyperinsulinemia, you now find yourself bathing in, also causes your fat stores to release fat inappropriately. This ultimately swamps your liver with excess fat energy. To reduce the excess energy, your liver starts frantically producing and pumping out lots of blood glucose. This task, gluconeogenesis, is costly and momentarily solves your liver's crisis of energy excess. The longer-term cost, however, are serious consequences like high blood sugars, unstable energy levels, damaged tissues via glycation and ROS, neurodegeneration and worse body composition, with fat usually stored in the wrong places, etc. There are 2 different types of diabetes, type 1 and type 2, and they differ in their causes. Type 1 is an autoimmune disorder where autoantibodies attack the insulin-producing beta cells in the pancreas too. As a consequence, type 1 diabetics produce hardly any insulin. They need to inject insulin to cover what's called their basal insulin need. They run into issues when trying to cover their carb intake too, which we'll get to. Type 2 is caused by environmental factors leading to increased insulin resistance, like the 3 big dietary factors: sugar, flour and seed oils. To understand what insulin resistance is, let's first have a look at insulin's role in the body. Insulin has 2 main tasks: to cycle fats into an